Good evening, everyone, dear colleagues and students. Okay, so good evening, everyone. It's my pleasure to be around. Thank you, Professor Mu'min, one of my teachers, for your introduction. I'd like to thank the scientific committee, Dr. Firas Al-Freih and his team for the invitation to speak to you tonight about the future of hemoglobinopathy in KSA. That was the task I was given, but being the director of the hematology programs at MOH currently, the talk will include the blood disorder program in general at MOH. I'll take you through the blood disorder program, how it developed, and the projects in the future. Over the coming 20 minutes, I'll be sharing with you our journey. So I'll talk to you about the idea and then our vision and mission. The whole idea started in 2019, actually, with a simple Scrabble game or a project. That was the vision that we've built the program on, and I hope that you know the Scrabble game. So I'll take you through this quickly. So the whole idea started with having limited services and how could we move those services around to obtain new service to help the hematology world at MOH and in Saudi Arabia. So the T's compose the regional management or the territorial management team assignment and the TOT programs, twinning programs as well. The C's is our avenues for blood and future for blood disorders. That includes See New Hope to sickle cell disease and blood avenue. As you could see, each letter would compose a different service that hopefully will be available at Center of Excellences at the blood disorder programs. The C's are the consultancy clinics and centers. The EC are the electronic health clinics and the telemedicine. And hopefully in the future, we will have the CCCRC, which is the comprehensive care clinic and a bigger research center in the kingdom, inshallah. So in 2019, the inspiration started. We started with going down to sites at MOH. We've assessed 25 inherited blood disorder units and centers. We did 8 workshops, and we've developed the vision and the KPIs for the program. What we found at that time when we examined how many sickle cell disease patients we have at MOH, we have around, based on surveys, we have around 65,000 patients. That was the initial survey. And then the assessment, we went down to centers and dissected the assessment based on the patient's journey, all the way from the emergency room, as you could see on the slide, to admission, to all the services available, including transition from pediatrics to adults. We've developed our vision to become a globally renowned program promoting evidence-based science that empowers the community and partners to prevent the incidence of blood disorder and improve patient quality of life. And then the mission to deliver the highest quality comprehensive healthcare model to affected individuals in Saudi Arabia in a robust operational context by promoting research, clinical care training, and advocacy. And these are the fields and the goals that we worked on that I'll take you through during this presentation. So the first one are registries, research, and empowerment. We have 2 ongoing registries right now. The first one is the sickle cell disease and thalassemia registry, started in 2019. It will go in 2 phases. Phase 1, that is actively now enrolling patients, is to capture all relevant data on sickle cell and thalassemia patients. We've included 25 MOH hospitals. We went into charts and database 3 years retrospectively, and hopefully we're moving prospectively. It includes 14 sites that has electronic medical records and 11 sites with paper-based records. And we've developed actually digital platform that has more than 355 different patient variables. Phase 2, inshallah, that will start in 2021 this year. We will include additional 15 EMR sites. We're hoping to include more than 25,000 sickle cell and thalassemia patients. We will have our dedicated study coordinators going down into sites, and we will generate reports, and research hopefully will kick off. The objectives are a lot, and it targets not only patients, but physicians, providers, the healthcare system, and society and economy. It will help us in the future to create center of excellences and be productive in the field, promoting health for those patients and allowing us to use new products as well. Currently, and as of last week, we have about 4,000 patients registered at the sickle cell and thalassemia registry. So this is in a nutshell. I have lots of data coming out from the registry, but just because of the time commitment. The second registry that we're starting this year is the Hemophilia and Bleeding Disorder Registry. But basically, these are the milestones and the timelines where we'll start with the site's readiness check, recruitment, and then coordinators will be onboarding. The soft launch will happen hopefully towards the end of the year, and we will end up with site audits and another visits to the sites. The second project that we're working on are the training and skills development, and we have 3 ongoing and planned programs. The first one that we're very excited about is called the SHIFT program. It started this year and it will end up inshallah in 2022, but it will continue as train the trainer programs. The second program is the clinical practice for cognitive behavioral therapy in sickle cell disease, kicking off this year. And the last training program, or at least the planned training program this year, is the Hemophilia Rare Bleeding Disorder Training Program. So let me tell you briefly about the SHIFT program. It's composed of 2 main components. The first one is called the ARISE University College London Training Program. And the second component is the General Practitioner Counseling for Hemoglobinopathy. The ARISE is the Africa Research and Innovative Initiative for Sickle Cell Education, improving research capacity for service improvement. It is an ongoing program in Africa, Europe, and London, and there are many countries that are contributing to this program and involved, and the Ministry of Health is part of this now. But just in summary and very quickly, the objective is to evaluate the prevalence of sickle cell disease in targeted countries, to establish the laboratory diagnosis and quality assurance system, to test the feasibility of establishing newborn screening and other screening programs, and to develop best practices in clinical management for acute and chronic complications in sickle cell disease. The program is composed of 8 working packages, and it will be virtual for 3 months for candidates that will be selected from the Ministry of Health between hematologists and nurses taking care of patients with sickle cell disease. And there will be 2 weeks of physical preceptorship at UCL related hospitals. The second component of the SHIFT program is the General Practitioner Counseling Training Program. We are in the final steps of publishing a new book called The Optimal Guide to Hemoglobinopathy Counseling, and we've developed a training program based on this book. It's a 1-day workshop provided by 2 instructors who are the authors of this book. There will be a total of 14 sessions to be conducted across the kingdom, and we will be training more than 200 general practitioners to how to counsel patients on hemoglobinopathy, sickle cell disease, and thalassemia. The second project or training program that we're planning for, the clinical practice for cognitive behavioral therapy in sickle cell disease. We're partnering with the Cleveland Center of Cognitive Therapy, and we've developed a tailored coaching and communication skill learning program to provide Saudi MOH healthcare providers the required transformation approach to interact with sickle cell patients. There will be a learning journey. It's a virtual and a physical attendance program. The program will cover all aspects of CBT in sickle cell disease. That includes depression and anxiety, personality disorders, self-mutilation, marital dysfunction, and non-compliance. The instructors of this program will be from Cleveland, a 6 weeks duration virtual program that includes 12 hours live discussion on a weekly basis. And this will be on depression, and the second component will be on stress and anxiety disorders. But then we will have a dedicated deep dive in sickle cell disease that we will be providing 2 days dedicated sessions, physical sessions to train on sickle cell disease as a disease. And then Professor Kofi Ani from UCL will do the cognitive therapy in sickle cell disease. And there will be 3 days duration of transformational coaching within this program. The third project is the Hemophilia Rare Bleeding Disorder Training Program. And it is a 360 education program for physicians and nurses working hopefully at future center of excellences for inherited blood disorders to disseminate the knowledge and to better manage hemophilia in Saudi Arabia. It relies on five pillars. The first one, we're doing a virtual capacity assessment, followed by virtual tailored theoretical training sessions, and then there will be flights to UK to visit UK Center of Excellence for bleeding disorder, and we will be doing outcome evaluation monitoring, and finally, the trainee for this program will come back to the country for local knowledge dissemination and preceptorship. The third goal of these projects is to focus on education and knowledge dissemination, and these mainly on publications of consensus statements and guidelines of different diseases. We've published already at the MOH website the Guide to Management of Pregnant Patients with Sickle Cell Disease. We have another publication on COVID and sickle cell disease. And I'd like to thank Dr. Mohammed Al-Shahrani on being the lead on the consensus statement on the care of patients with hemophilia rare bleeding disorder in Saudi. It's a work in progress. I'd like all the contributors and the team working and dedicated to produce this project. The last one, or not the last one, at least what is planned for this year, is to develop consensus statement on the care of patients with sickle cell disease. And I'd like to invite the audience to participate in this, and I will have my contact information towards the end of this session. And then we will be talking about the prevention programs. So we have two ongoing prevention programs. The first one is prevention of long-term complications of sickle cell disease and thalassemia, and this will happen through the Saudi Virtual Hospital that I'll tell you more about. And the second prevention program is the newborn screening program. So the Saudi Virtual Hospital concept developed honestly from what we've experienced during the COVID. So this is just a screenshot of the dashboard on the National Telehealth platform that we've been doing at MOH. So lots of virtual clinics happened, and there is, as this dashboard will show you, there's a huge need for virtual that we have to move the future forward with it. So the whole concept had developed the Saudi Virtual Hospital. So the Saudi Virtual Hospital is a very new, innovative project. It's actually a physical hospital present right now at the Digital City where the new MOH building is. There is a full floor for us to provide remote healthcare services, which will benefit from the specialized and available expertise. It's going in two phases. The first phase is starting April 1st and will be launched, which includes virtual clinics for the following specialties. So we're starting the hospital with rehabilitation clinics that will provide physical therapy, occupational therapy, speech and language disorder, and rehabilitation medicine. And the other clinic is the blood disorder clinic. So we have two clinics, the sickle cell disease clinic and the thalassemia clinic. And finally, we have the teleradiology clinic. Phase 2 will include virtual stroke service clinic, tele-ICU medicine, EEG virtual service. Over the coming 2 minutes, I have a video actually to show you, but unfortunately it's in Arabic. So let me just explain to the non-Arabic speaking audiences how this will work. The Saudi Virtual Hospital is the hub hospital, and we have many spoke hospitals connected to the hub hospitals. And these are the remote and other hospitals at MOH. And the referrals will happen to these clinics. These are weekly clinics. We have two applications to use. The patient will be present with the physician at the spoke hospital and will use an application called Sihati. And the physician at the hub hospital or the virtual hospital will use an application called Ezzat through the Saudi Council. We've distributed iPads and devices to spoke hospitals to connect with patients. So let me just show you the video because it's actually quite interesting to see. It will take 2 minutes.
دكتور خالد قرر ان المريض عبد الله يحتاج احاله الى مستشفى اخر للحصول على الاستشاره مع استشاره الانيميا المندليه. منسق الإحالات في المستشفى قام برفع طلب إحالة على نظام إحالتي، واختار المستشفى المطلوب للإحالة إليه، وأرفق جميع التقارير اللازمة. استقبل منسق الإحالات في المستشفى الآخر الطلب، وقام بمراجعته مع دكتورة سارة استشارية الأنيميا المنجلية، واللي وافقت عليه. تواصل فهد منسق المواعيد في المستشفى الآخر مع صالح منسق المواعيد في مستشفاه، واتفقوا على الموعد المناسب للدكتور خالد ودكتورة سارة. صالح حجز الموعد لعبد الله في نظام مستشفاه حسب الوقت المتفق عليه، وفهد حجز موعد في منصة الطب الاتصالي مع دكتورة سارة كطبيب أساسي، واختار دكتور خالد كطبيب ثاني في الموعد. عبد الله وصلت رسالة تأكيد موعده، وأيضا قبل الموعد بيوم وصل التذكير برسالة، وقبل الموعد بيوم تواصل صالح مع عبد الله وبلغ بضرورة حضوره في الموعد لعيادة الدكتور خالد. وفي وقت الموعد دخل الدكتورة سارة من عيادتها على رابط قناة، ودخل عبد الله من تطبيق صحتي واللي تم تحميله مسبقا على تابلت العيادة. وفي نفس الوقت دكتور خالد داخل على ملف المريض وعلى منصة أنات من جهازه. دكتورة سارة عاينت المريض عبد الله وحصلت على كل المعلومات اللي تحتاجها بالاستعانة بالدكتور خالد، وعطت توصياتها للدكتور خالد بخصوص الوصفة والطلبات، واللي بدوره أدخلها في ملف المريض. وبالتأكيد دكتورة سارة سجلت كل ملاحظاتها وتوصياتها في منصة أنات، وعطت توصية بالموعد القادم. فهمت بناء على توجيهات دكتورة سارة، وإذا في موعد متابعة راح يكرر نفس خطوات التنسيق للموعد مع صالح للتجهيز للموعد القادم. دكتور خالد والمنسق فهد في أي وقت يقدرون يدخلون ويراجعون التوصيات اللي سجلتها دكتورة سارة في منصة أنات بخصوص موعد عبد الله. وبكذا عبد الله حصل على موعده مع استشاري متخصص دون أي سفر أو عناء، ودكتور خالد استعان واستفاد من خبرة الدكتورة سارة وتعلم منها. نتمنى الصحة والعافية لعبد الله ولكل مريض.
Okay, so that was basically the Saudi Virtual Hospital and the Sickle Cell and Thalassemia Clinic. The second prevention program, which is Project 2, is the newborn screening program. So the newborn screening program currently in Saudi Arabia is happening for 16 inborn error of metabolism disorders. Finally, we got the approval to add sickle cell disease and thalassemia to it. And the HPLC method was the method of choice. And we will have this happening through the third quarter of this year. And I've just presented to you some of the figures and the pathways that we will be using during this program. The operational excellence is one of the goals of the blood disorder program projects, and we have 3 operational excellences projects. The first one is the hematology supply chain dashboard at the NHCC or the command center at MOH. The second one is the KPI, and we've developed a new clinical KPI that we're monitoring. And the third one is building comprehensive care centers for inherited blood disorders. So the hematology supply chain is located right now at the command center at MOH, and we have our dashboard there. We're monitoring 102 medications for hematology at 42 MOH sites. We get weekly tickets for solutions sent to the sites to resolve problems. And we have actually a weekly gallery walk with the Vice Minister to monitor these dashboards, including the hematology dashboard. The second one, we have KPIs for hematology and for other services, but we've developed a new clinical KPI called the door to painkiller time for sickle cell disease. And this is what it shows. So we do the monitor for this KPI on weekly basis, and the site will report to us those patients with sickle cell disease that presented with vaso-occlusive crisis and pain to the emergency room and have been treated less than 30 minutes from their door time, and greater than an hour and between 1 to 3 hours. And these KPIs are produced on weekly basis and monitored by the minister himself. The third project is Comprehensive Care Centers for Inherited Blood Disorders. And this is a project that has been waited for a long time, actually. And we've started with the third-party company working on development of Comprehensive Care Center. The first one will be in Al-Hassa, inshallah. And the second one, we're working in parallel in Al-Qamfuda area. But basically, the idea behind the comprehensive care center is not to do solo buildings. We are actually inside hospitals with the idea of having an infusion/transfusion units that operates 24 hours to manage pain and transfuse patients with inherited blood disorders, gift factors. But at the same time, these centers are located at the OPD buildings, although they operate for 24 hours, but they will have the access to hematology clinics as well as other specialties needed for the multidisciplinary approach. The last one, which is actually huge, is continued collaboration. So I'd like to take this chance to thank all our collaborators from within the ministry, outside of the ministry, other institutions, other colleagues at hospitals, as well as societies and pharmaceutical company. I've put here all the contact information for the blood disorder programs. Please try to reach out. The task is huge, but the future is so bright, and we would welcome all the ideas and all collaboration and contributors. Thank you for listening, and I'd love to welcome any questions.